We all know that smoking is bad, and smoking is bad for everyone, obviously. But what's important to consider is that over the last decades, prevalence has fallen consistently in the general population, now being around 21% in the UK. A population in which it hasn't fallen at all is the people with mental illness, and particularly those with severe and enduring mental illnesses such as schizophrenia.
Smoking rates in people with mental health issues can be double or even triple those in the general population. The more severe your mental illness, the higher the prevalence of smoking and the more heavily dependent you are on smoking.
Not only do people with mental illness smoke more frequently than others, but also they smoke more heavily. They are usually, they tend to be quite heavily addicted to tobacco for reasons that are not entirely understood. They are quite complex. So there are neurobiological links, there are environmental and psychosocial factors, and there are also genetic links.
Research shows that the same proportion of people with mental health problems want to stop as those without mental health problems. So that's not the inhibiting factor. It's more that people aren't being offered treatment at the same rates as people without mental health problems. People aren't intervening as much.
It's probably fair to say that the historic smoking culture that has been alive in mental health settings for decades is still quite persistent, and that's despite the implementation of smoke-free policies that came into force in this country in 2008.
In many mental health settings, although they're smoke-free in the buildings, they still have patios where people can go and smoke. And often opening of the patio will be, a key event in the day of someone who's an inpatient, for example, and they can open the patio every hour and people will be then accompanied out to smoke. That uses an awful lot of staff time. So what we have to try to do is change that so that staff's time is being used to help promote the health of people with mental health problems rather than supporting their smoking.
Sometimes we've come across cases where people have been actively discouraged to stop for reasons related to concerns that stopping smoking might exacerbate symptoms of mental illness, or a certain protective attitude of staff towards their patients, according to which they shouldn't run before they can walk, that sort of thing. Don't worry about your smoking now, you've got more important things to look at or to worry about.
We know that people with mental health problems, their life expectancy is much shorter than people without. So around 16 to 20 years in some cases, people will die earlier. One of the things we want to look at here is what proportion of that difference is explained by their smoking. What we do know is that for most people with mental health problems, many of them will die because of their smoking rather than a result of their mental health illness.
Nobody's suggesting that this is only the case because they smoke, but the fact is that death and disease related to cardiovascular illness and cancers are raised in people with mental illness. And those two, cardiovascular disease and cancers, are also linked to smoking.
We have a moral duty to ensure that they're offered the same treatment as people in the general population. Otherwise, health inequalities will only increase for this group.